Hi, everyone. I'm Dr. Tom Harder, and tonight I want to talk to you about the healthcare crisis. It's late, dog sleeping in the other room. Everyone else is headed off to bed. I'm alone in the room where I watch television, and I'm getting worried. Let me tell you why. I've been in practice for 30 years, practicing medicine for 30 years. My entire life, never thought I'd live through such a healthcare crisis as we are seeing caused by this novel coronavirus pandemic. While the emergency rooms are overcrowded, we are seeing an opposite crisis happening in our small doctor's offices that millions of Americans rely on daily. Due to all the stay-at-home orders, patient volume in the office has dropped by 70%. We're not meeting overhead. Why is my office going to close? In the United States, we've got an entirely privatized healthcare system. Every doctor's office is a small cottage industry. I've got to pay the rent. I've got to pay the employees. You guys know the drill. Money in, money out. Without money in, there's no money out and nobody gets paid. So, during this time, with all those stay-at-home orders, and, it's important, I suppose, no patients are coming to the office. As a stopgap, the government said we can make video appointments for patients. Let me tell you, it's not working. It's inefficient, and I still find myself unable to meet adequate numbers of patient visits to pay the overhead. Why is this? These video visits are just really too difficult to complete. Think about it. Most of my patients are of an older generation, and they don't understand all this video technology. Come on, think about it. You've got your grandmother. She's 75. She's supposed to come and see me because of her rheumatoid arthritis. By the way, I'm a rheumatologist, and I practice in Wynwood, Pennsylvania. So I've got all these patients with these chronic illnesses that require my care, and here I am asking them to set up a Zoom appointment or a FaceTime appointment. It's not happening. Because of the crisis, I'm already short-staffed. We usually have 14 employees in the office. I'm down to about 3 or 4, and they are spending all the time in the office during the day trying to walk patients through these technological drills to set up televisits or video visits. It's impossible. And by the way, medicine via video call also excludes all those low-income patients that I have who don't have access to Wi-Fi, smartphones, or a comfortable place to talk to me. It's impossible. I don't know who set this up or why they thought about it. Imagine this. During this crisis, a lot of people are home and they're doing everything on the computer. The broadband availability is not there. Doctor's office visits have to happen every 15 minutes. Imagine a sluggish computer processing. My computer keeps crashing. Not one of my visits is happening on time. And take, for example, this afternoon, I had 12 visits scheduled. We only got 3 of them to go through. I'll have to call my computer technologist, and he hasn't been that available. Just haven't had any time to catch up. Anyway, if I can't keep seeing patients at an adequate rate to pay overhead, my office is going to close in 2 weeks, and my patients are going to be left without a doctor. And this story is being played out in doctors' offices all across the country. Thousands of office employees will be out of work, and you might say, well, so what? We're all out of work. Well, there are a lot of patients that need us. And I'm not saying I want to make money during this time, but I want to be available for somebody who's got chronic disease. You need a medicine refilled? I'm not going to be there. If your sister or brother needs a medicine refilled, we're not going to be there. Think about it. The pandemic is going to have more victims beyond the COVID-19 patients, and we can't wait for that bailout. We don't even know if these small doctors' offices are going to be part of the bailout. But anyway, Congress act now. Keep our offices open for all our patients who need ongoing care. Your patients with rare blood diseases, your daughters with asthma, your loved ones with diabetes and heart disease. Everybody needs their doctor. And believe me, when I go down the hall and talk to the doctors, they're not seeing enough patients to keep their offices open. You can take a rosy attitude about this and say, oh, the government's going to figure it out. And I'm thinking, I don't know about that. Think about it. Anyway, there's a really easy solution. Now, this is the really exciting part. Imagine this. You listen to my video tonight. It's a long one, it's rambling. But listen to the solution. Have Congress end the video call requirement and allow us to bill for 15 patient phone calls a day, but not bill at a rate of $15 per phone call. Allow us to bill at a normal rate as though they were seeing us in the office. So give us reimbursement for a full charge for an office visit. That number of phone calls, 15, will allow us to keep the office open. It will give us enough money to pay for the overhead and pay the rent. It'll allow us to pay our employees. And it's going to allow us to provide the necessary care to patients who need it. Think about it. Everybody's worried about all these patients being driven to the emergency rooms and whether or not we're going to be able to provide care. And here I am in a doctor's office close to the hospital, and I don't have enough patients to stay open. I don't think the patients understand this. So Congress, change this policy about the video requirement overnight. Allow the doctors for the next 3 months to charge full office visit rates for a phone call and keep the phone calls at only 15 per day. We don't want doctors making 45 phone calls a day and abusing the system. Just allow us 15, and that'll be enough money to keep us open and running through the pandemic. Believe me, it's worth it. By doing that, you're going to avoid a costly bailout of the doctor's offices. You're going to avoid having to pay unemployment for all the staff in hospitals. And you're going to keep some optimism going in the local communities. Again, I'm Dr. Tom Harder. Thank you for listening. It's late. I'm extremely tired. I've been worried about these issues for 2 or 3 weeks now. And we need your help today. Good night.